Hello, this is Dr. Earle Williams again, here to talk to you a little bit about depression. Today, my topic is going to be major depressive disorder. You know, there are a lot of different types of depression that people can suffer from, but major depressive disorder is the one that's most prominent. It's the one that happens the most amount of times. Depression, especially major depressive disorder, is the type of disorder that is rampant in the United States of America. Some of the symptoms of major depressive disorder are persistent sadness, emptiness, hopelessness, pessimism, loss of interest in things that you used to enjoy, suicidal ideations, homicidal ideations. Also, you find yourself being fatigued and tired all the time. You might even have the vegetative signs of sleep or appetite disturbance, which actually means either you're sleeping more than usual or less than usual, or you're eating more than usual and less than usual. Also interferes with your memory, your focus, your concentration. It just disrupts all of these functions and will therefore disrupt your daily happening, your daily functioning. You just can't seem to get anything straight. You can't seem to just do anything. You're just a loss of energy. And that's why it is seen as a very serious disorder that can disrupt your life and your ability to function. So anyway, sometimes the display sometimes one of the symptoms can be joint pain. So it can actually be physical, or even back pain can be caused by depression. So how, you might ask, is it displayed in people? Well, for some people, they go through a lot of crying spells, feeling down, feeling helpless, not knowing which way is up, feeling lost, and those are the typical symptoms that we expect to find in a person that's suffering from depression. But there's also another display of depression that people actually often overlook. And that is anger. So while major depressive disorder can cause symptoms of suicidal or homicidal ideations, that is, thinking about hurting yourself or hurting somebody else, it can also be displayed as anger. Matter of fact, in many men, it is displayed as anger. Matter of fact, to tell you the truth, it is my depression and the expression of my depression as anger that got me sent to prison. I'll talk more about that at another time when I'm talking about my background. But for right now, I just want to talk about major depressive disorder. I was doing a series of, because I'm a forensic psychologist, I'm a forensic clinical psychologist, one of the things I do are evaluations on people to see if they're competent to stand trial and whether or not they were sane or insane when they committed their offense. And so in that capacity, I have, for 30 years, I have evaluated many, many men that were arrested for crimes that they committed, and instead of them being sent to prison right away, they were given an opportunity to have an evaluation by a person such as myself. So now I would say that I've probably done about 2,000 or 3,000 people in my lifetime, 2,000 or 3,000 evaluations, forensic evaluations. I have found that 80% of the men that I have done a forensic evaluation on have been sexually abused as children. These are men. And these are generally black men, So what's to say that their anger from having been sexually abused, is an expression of their depression and what contributed to their lawlessness and their criminal types of behavior. recently, I was doing the same thing for teenagers, now that we have this whole idea of school shootings, so they take verbalizations, threatening verbalizations of high schoolers very seriously these days. So I've done about 4 or 5 of them lately. It wasn't something that I did a whole lot of with the school thing. So now I have a kid that was sent to me because he threatened to hurt a security guard. I said, okay, all right. And I did the evaluation and I talked to him. Come to find out that with psychological testing, that he does suffer from depression because of life circumstances that I really don't want to go into. But the other thing that set him off that particular day is that he asked to go to the bathroom. It's a black kid. And the security person wouldn't let him use the bathroom. But after he asked to go to the bathroom, a girl asked to go to the bathroom, and this female security guard let the girl go to the bathroom but wouldn't let the boy go to the bathroom. And that is what precipitated his threatening the guard, that he wanted to hurt her. That was a display of his depression. So we have to have a different way of looking at depression and remember that kids and children and teenagers are more likely to express their feelings of depression with anger rather than sadness. So that's just a little something to kind of keep in mind. All right, so anyway, that's a little bit about major depressive disorder. It's a disorder that generally is going to require some sort of psychiatric intervention, if that's the diagnosis. Because you can be depressed, but it may not be a major depressive disorder. Okay. The other thing you need to know about major depressive disorder is that it can be inherited. Depression does run in families. There is a genetic component. Depression, like bipolar disorder and schizophrenia, has a genetic component. So it can be inherited and passed down from one generation to the next. Okay, so anyway, that's all I'm going to talk about today for major depressive disorder. I'll talk about some other depressions like seasonal affective disorder, and other stuff. So anyway, stay tuned. Thank you.